Hello, everyone, and welcome. It's great to have you all here. And it's great to welcome Clay Kirkland, who is a product specialist at Specops. Clay, welcome.
Thanks, Mark.
Absolutely. Great to have you here. Very briefly, tell us about Specops, and then we are going to talk about security.
Great. Specops is primarily a password management company. We have a couple of products in that space. And for me personally, I've been in the IT industry over 20 years now, have worked in different roles with corporations and resellers from various roles such as an engineer to a solutions architect, and now I'm a product specialist like you mentioned.
Wonderful. Well, great to have you here. We are going to talk about password-related cybersecurity. This is something I'm really looking forward to getting your insights, because this is an area where I think there are a lot of myths. I think there are a lot of misconceptions. I think there's a lot of there's a lack of awareness of some really basic things. So let's start with a really basic question. Why is password-related cybercrime still such a prevalent issue when developing strong passwords seems like an easy fix? What's really going on there?
Sure. Well, and the password just had its 60th birthday a while back, and so they've been around a while. I think the thing to keep in mind is that because they're a text-based, they're easy to misplace and for people to capture that information. And over 80% of hacking-related breaches are stolen or weak passwords. And I think it's the thing to remember is that we can always have a stronger password. It doesn't have to be harder to remember. And so because it's text-based and it can be scripted and breach passwords are out there, it's just an easy piece of information to guess or to brute force attack.
Right. Now, I don't want to get too far down into the weeds on this, but one of the things that's been happening recently, and those of us who are lay people do get a little bit confused because different experts are saying different things, right? But one of the things that's being said more frequently now is the idea that we should really start transitioning to passwords that are phrases or almost whole sentences, and that it's not so much whether you have a special character or a numeral, but that the longer a password is overall, the better. Is that correct? Is that true?
That is true. And it makes it harder to computationally brute force, because once you get past about 12 characters, the time with current compute power gets exponentially higher to crack that password. And so it also makes it easier to remember if it's an easy phrase for the user to recall.
Okay. And I'll just ask a little follow-up out of personal interest, but this might be useful for others too. I speak several languages, and one of the things that I've incorporated is multiple languages into passwords, into the same password. Is it just as a quick thought, is that helpful, do you think?
I think that's a great idea. It makes it even more complicated. If you're searching against a dictionary of words, then you've got to look up multiple dictionaries. And so that's a way to add complexity in a sense without having to use, strange characters.
Great, great. Well, I've been doing it, so not that I'm going to reveal any more than that.
That's right.
On this program. So let's talk about breached passwords. What does it mean when a password is breached? And where first of all, let me actually back up a little bit. Who, and I don't mean like names, John Smith, Jane Jones, but who is breaching passwords? Meaning, is it organized crime groups of hackers? I know in some cases there have been state operators, but like what types of agents are breaching passwords? What kinds of skills do they have?
I think it really varies, Mark. I think that, there are data breaches that go back to, people wanting to breach large corporations and expose them to threat actors who have time on their hands and are trying to sharpen their skills.
Yeah.
Any place that somebody can find that information, it becomes valuable, because obviously if they have a list of breached information, especially passwords, that can be valuable from a dark web perspective. They can potentially monetize that, right, as well as use it for their own purposes. And so there are forums and obviously lists for sale out there And because they're known and available, it just makes it that much more important to kind of keep tabs on when there are leaked credentials, or do you have any leaked credentials in your environment?
Absolutely. So what does it mean in simple terms to breach a password?
Sure. It could be from a brute force attack where somebody computationally figures out what that password is, or it's made available via a hacked list, essentially, to know what it is in clear text or even in a hash.
Yeah. Yeah. Now, one of the issues that comes up is this idea of social engineering. Why don't we talk about that? How does that relate to a health IT department's level of responsibility for cybersecurity?
Well, sure. I think that's a good question. And, we see that about 90% of cyber attacks rely on some form of social engineering. Even if it's from that quiz you answered on Facebook about 20 things people didn't know about you, you probably gave those threat actors some good information, especially if your information is publicly available.
Yeah, it is. It is actually scary to me how many of these things are going around on social media, like these games, right? So, who, some of the questions are, silly, like what was the first flavor of ice cream you liked or something like that. But then others,
Sure.
when I read them on social media, I can see you could gain actual clues, like, they never do anything so obvious as to say, what is your home phone number? But it's like, uh, um, is your address within 1 block of a school, or something like that, where you could actually gain clues, right?
That's right. And especially when you think about, from the help desk perspective, that's why secret questions really are not a secure form of authentication.
Exactly.
And when you've given away your information in social forums or public places, and even when that is breached, you can't reuse that information in a secure fashion. So that's a great point.
Exactly. So what is it that is, we know that healthcare organizations are uniquely vulnerable in certain ways. I should say patient care organizations. I'll just tell you a 1-second story. Several years ago, I interviewed a cybersecurity consultant who worked in 3 industries. She worked in healthcare, financial services, and the nuclear industry, which kind of intrigued me, right? I was like, oh, that's fascinating.
Yeah.
And I said, semi-tongue-in-cheek, I said, what's the difference between the nuclear industry and healthcare, with regard to cybersecurity? And she gave me a really simple answer. She said, look, who among us could figure out the email address of someone working in a nuclear power plant? Like, you couldn't do that, right? You'd have to be a spy or something. But anyone can call up a hospital. And the classic example that's always used is you call up purchasing, right? And you say you're a vendor or you're looking for a package that went astray. And you ask, well, who might be in charge of that? And they'll say, oh, that's Dottie. Could I speak to Dottie? And you say, hi, Dottie, my name is blah, blah, blah. I'm with a vendor company. We sent a package to someone in your hospital, but we don't know where it went. Can you just give me your email address? They get Dottie's email address so easily, right? So what makes healthcare and patient care organizations in particular uniquely vulnerable to these kinds of attacks?
Well, I think it's what you mentioned, Mark, is that, when you think about your example of a nuclear power plant, they're not serving the public directly. And so you've got the exposure in a healthcare organization of that you're serving the public directly. And so the availability of information is critical to communicating, as opposed to a power plant where something's being sold. Healthcare, you're directly caring for people. And so when you think about all the means of access that threat actors have to information, like the example you gave, not only to the fact that you've got all of these devices that are proliferating in healthcare, you've got all of the access points, especially in a hospital scenario, all of the rooms and all of the devices that are available. And so when you think about needing to secure things like IoT devices,
right,
when you realize that stolen devices can make up 45% of industry data breaches, and that's something we learned from DigiCert, you just realize there's so much ground to cover. And
It's just mind blowing, right? There's the
it is.
classic thing that happened several years ago where a nurse case manager, I believe it was from the VA, but anyway, she was from a large, very large patient care organization. Her car was stolen and her laptop was in the car. It's like the classic thing. And then you have BYOD. Um, you're right, exactly. I mean, this is the thing. There's no way that you can unpublic a healthcare organization, a patient care organization. You're serving the public. You have a million points of vulnerability. So maybe give us an example of a cyber attack that we might be able to learn from in that regard.
Sure. And I think that there's so many out there because it's such a huge industry and there's so many patient care facilities. I think the stats tell us that over 550 organizations reported data breaches in 2021 alone. Obviously, that's a requirement of HIPAA is that you have to report when there's an incident, but that impacts over 40 million people. And so one example is St. Joseph's Candler Health System in Georgia, and they were down for days with basically having to fall back to pen and paper to help care for their patients. And so, with our reliance on technology to help us, sometimes when there's an event like that, it tends to hinder our ability to do patient care, and it can just cause delays in healthcare. And it's obviously there's exposure to lawsuits and all of that sort. And it really results in an increased focus on cybersecurity, but it really shouldn't come down to an attack for us to be focusing on that sort of security.
Exactly. Now, here's another particular challenge of healthcare. Our clinicians are severely overburdened, right? Physicians feel just crushed by everything going on, and nurses are the most interrupted people in healthcare, studies have shown. How do we encourage good password hygiene? How do we encourage good individual processes of clinicians and others on the front lines? They are, I'm sure you'll agree, they're very burdened people. They've got a lot going on, and physicians in particular, because they may have privileges at several hospitals and several clinics. There are physicians with privileges at 4 or 5 hospitals, 3 or 4 clinics, and they say, of course, they go insane with all the passwords, right? And some of them have 2-factor authentication that involves fobs. What's the solution to that? How do we make clinicians' lives bearable and yet also strengthen our security profile?
I think really we've got to use technology solutions to help our clinicians be freed up to focus on why they're there, which is to care for patients.
Yeah.
And so to leverage a solution that provides you the feedback that you need to streamline that process, allowing things that are memorable to end users, obviously, and then using things like multi-factor authentication that require something they have and not necessarily something that they know, to augment that. So maybe having a password that's long but memorable, and then also having a multi-factor solution in place to really make it as secure but as easy to navigate as possible. I think it's a great place to start.
Do you think there is any possibility we would go passwordless in the future?
I think we're several years away from that being a reality. I think that today the solutions that advertise passwordless still have a dependency on a password as a fallback mechanism. And so even in a world where we've got facial recognition and you've got bio readers on your phone, and the spy example of scanning your iris, there are obviously services out there, even in the travel space, where they're gathering bio information, which is great for that, but they're not authenticating against systems, and they're not having access to patient data and financial records and all that sort. So I think that passwordless from a production standpoint in healthcare is several years away from being even tested out.
And as you said, some vendors that offer quote unquote passwordless systems really aren't passwordless. I always think of free, right? It's free. Something is free, and then you find out it's not free. It's like when they're trying to sell condominium timeshares.
That's right.
Not a free offer. So Clay, you're with Specops Software, which is a password management and authentication software company. How can Specops help secure a hospital's infrastructure from all of these terrible attacks that we've been talking about?
Sure. Well, we've really got two solutions that can help, but the one I think that will help the most is our password policy product with the breach password protection add-on. And it can help users create and enforce passwords that are long and meet the requirements of the organization, but allow us to block known breached passwords. And we have a list of over 2 billion known breached passwords that we actively curate and keep up with. And then our product also offers real-time feedback so that users can see what the requirements are.
Great. And how can healthcare systems prepare for a more secure 2022 or rest of 2022? We're already in late February, but the rest of the year.
Sure. And I think that that's the things that the industry continues to tell all IT professionals, which is you've got to test your backups, you've got to have a plan for recovery, and you have to test it. And so that's, it continues to be a burden on our IT teams, but finding ways to automate that is a huge win from the perspective of the workload that they have to carry. Providing security awareness training to employees continues to be an important component in terms of how threats evolve and the behaviors that threat actors are looking for and also trying to solicit from people. Patching is another one that, sometimes there are patches that come out to problems and they're available for months and people are compromised because they were not aggressive in patching their solutions, especially their external facing systems.
Exactly. Do you think that we're in a better place, and I'm going to try to frame this carefully, for that CIOs, CISOs, and all those who work with them in patient care organizations are in a slightly better place now? And what I mean by that question is, we know that the threat vectors are only intensifying, or as one consultant who's a leader in the field said, the bad guys are getting badder. Do you think, though, that we're more aware than we were a couple of years ago? Do you think we're at least conceptually more prepared on our healthcare IT teams?
I do. I think awareness is obviously the first step to taking action. And I think that organizations have had to become more aggressive now that there is so much awareness and there have been so many publicly acknowledged breaches. Obviously, there's a fear factor in there, but there's also the responsibility to take aggressive steps to protecting patient information as well as financial information.
Great. Any final advice for our listeners or our viewers in this case?
To be ever vigilant in keeping up with the things that I mentioned in terms of how to keep your organization secure. And then obviously having a solution that helps you take password security seriously. Absolutely,
I agree. And I'm sure you'll agree that password 123 is not a secure password.
No, that's on our breach list, and I know that for a fact.
Right. I am amazed. One can Google this, and I did so a while ago. I was just astonished at common passwords that people were using. Literally password 123 or their name. Like, you're not supposed to use your name, or very easily discoverable things. People use their home address or part of it. There are things you should, don't use a spouse's or partner's or child's name. And obviously there are very, very, simple number combinations. 1, 2, 3 it's just not going to cut it. Right.
That's right. And we also see things like the season and the year used. So fall of 2021, things like that. So things that are fairly easily guessed and are known common combinations.
Right. Exactly. I'll just say, I'm glad in this context, I'm glad to be a multilingual. That's the biggest clue I'll give. So
there you go.
Yeah. Anyway, great to speak with you, Clay. I've learned a lot, and I know our audience has. So thank you so much.
Of course. Thank you, Mark.
Great. So thank you to you and our audience for participating by viewing. And this concludes this session. Have a great day, everyone.